parenting approach I feel is like you need to set boundaries, but with compassion, with support, with warmth. Why you want to keep it to yourself? Like I've seen that, and also in Asian parents, I've seen only one parent does everything, and other parent just is not there. Parenting is not that.
What is common side effect?
The loss of appetite. They lose their appetite. They might get some headaches. Sometimes they become hyper. I mean, like more. It gets worse actually. Right. Currently, what's happening? I'll tell you why. There's a shortage in medication. We are really having a struggling everywhere in the UK, I think.
Welcome to Ujwala Sangam, an ADHD specialist, a pharmacist prescriber with over 18 years of collective experience across various sectors in hospitals, both NHS and private GPs, community pharmacy and pharmaceutical industry. Ujwala is the founder of Medgene Precision Health, an innovative initiative. Welcome to the Impact Show.
Ujwala, thank you. Thank you for joining today. Since we are an impact show, we would like to start with a question, impact. What impact you want to create?
Thank you, Shyam, for having me. It's been a pleasure being here. The impact I want to create is like, I've been in the industry, medical industry for 18 years. So I want to make it as a holistic care. So especially I'm being an ADHD now specialist. So it's both not just a medication, but everything, like including genetics and holistic care. As a patient, not one size fits all approach, but it's a personalized care for each individual. So that's the impact I want to creating, hopefully with education as well, because that's a major part of it for the parents and children.
Let's start with the basics. What is ADHD? How it manifests in children?
Okay, just to give elaborate it, ADHD itself is called Attention Deficit Hyperactivity Disorder.
Yeah.
All right. So it actually manifests as a three-component, like in a inability to kind of concentrate, hyperactivity, and impulsivity. So it does as a three categories majorly. So one is either predominantly hyperactive or predominantly like impulsivity or combined. ADHD. Yes. So it's three types out there in ADHD. That's what it does in children. So when you asked me about how it manifests in children, you might be seeing some children, they're not able to concentrate, or even though you tell them what to do, they can't get the timing right or anything like that. So simple. There are a lot of things out there in that, how they manifest. And in the boys, it manifests as an hyperactive, like you see a fidgeting child, but girls do in a different way. So it is a gender as well different. So that's the reason why we categorize three different types, like predominantly impulsivity, predominantly like lack of concentration, or combined. So a child will have both. So that's how it is. And so ADHD, as I said, it has a patterns of behavior. That's what it does. So in a child, and in most situations. So different patterns of situations, how I said to you in the before. So inability to concentrate, hyperactivity. So there is a lot of patterns out there. That's what it manifests as.
Basically, first, we don't know what is ADHD here. And even though we've seen some symptoms, but it's quite difficult or challenging to identify.
No, it's not, but I think it depends upon how you see it. Say, for example, if you're seeing a child persistently in school, usually we say ADHD is not diagnosed before 6 years old. It's not. So we prefer, that's what it's psychiatric association or manual they use, guidelines. Every psychiatrist in the world, they use the same thing. It's a DSM-Y. That's one of the diagnostic tools we use for ADHD. So the treatment is to be started from the age of 6 years old. You can't start a medication, but you can get diagnosed before that. But you will see, because they are overlapped. These are all neurodevelopment conditions. It's autism. There is ADHD. They are overlapped. So we see a lot of kids who are autistic also has a ADHD. So you pick up on those things, how they are behaving, how consistent they are. So it's like, say, for example, if a child at home is showing that some of the symptoms, but in school is fine. He's able to concentrate. Then that's not ADHD. There's something else going on. So that's the reason why it says that the consistent patterns we need to see in 2 or 3 situations, not just in one home or just one in school. You have to see in a different situations. It's a consistent and different settings. That's very, very important, vital in diagnosing ADHD. Because you might be missing out other diagnoses like mood disorder or anxiety, it could be. So we need to rule out all those things. So that's the reason why ADHD is not being, like it's a specialist area, a very niche area.
Sure.
GPs can't diagnose. It's only psychiatrists. If it's the children, the community pediatrics who are there, specialized in that, they diagnose it.
Okay.
So it's a lot of questionnaire goes in there, a lot of assessment goes in there.
Sure.
So it's not just like you come in and you know how we do diagnose other things, test and all, because usually mental disorders are not, it's a very subjective diagnosis.
I can imagine.
It's not a blood test, exactly. It's not a blood test and then you do it. So it's a lot of questionnaires goes in there, and from that we scale it. We plot it, and then we diagnose.
Sure. I can certainly imagine. I have 2 young kids. I have friends' kids as well, because we are not sure, so they're active in the sports. Yeah. Okay, thank you. Can you address some misconceptions of ADHD?
Yeah,
please?
the biggest one is they don't even believe there is an ADHD.
Yeah.
So that's one of the big ones.
Accepting it.
Not even accepting.
We don't know. That's knowledge.
They don't understand ADHD is a condition. It's a mental disorder. That's what the problem is. And then they think it's because the child is lazy, or maybe they don't want to do it.
Sure.
So that's why they don't believe in that. Okay. And the other one they think is like, okay, one is doing, like say for example, somebody likes sports. They will be concentrating so much on sports, but they can't study. They think, parents might be thinking, or someone thinking, why if you can do on one thing, why you can't do other thing? So it's purely your laziness, and you don't want to do, but it's not that. It's a different how the brain works, the ADHD brain. So they might be very good at something,
okay,
and they may not be which interests them.
Sure.
Okay, but which it's not. Okay, that's one of the things, and those are the major ones.
Sure. So what signs and symptoms should parents look at if they suspect the child
is unable? Okay. The major one, usually everyone sees a hyperactivity. So if the child is fidgeting a lot and they can't sit like for not even 5 minutes, which they don't like. Say for example, the child doesn't like maths, and they can't even sit straight for 5 minutes. Then they just want to move around, walk around, and they want that breaks. Okay, that's what they show. Okay, they manifest that. That's one. Or they just blurbs up, like they don't even finish. You don't even finish the question, but they just blurbs up the answers.
Yeah.
So that's one of the things. They may not be able to kind of like say. Poor sleep might be one of the reasons as well. ADHD has got very manifestation of poor sleep, and I think they might be picky eaters, and especially in the concentration, which they can't sit, they can't share, they can't like it has to be like an impulsive, like they're in like a motor. The brain is like in a motor. They're on the go all the time. That's what you see most of the So, but hyperactive, when the child is hyperactive, mostly it manifests in boys. That's why it's picked up more in boys. It's misdiagnosed in girls. It's not diagnosed very well in girls, because girls are naturally not very hyperactive. They're not fidgety. But they have got other symptoms where we need to work out. Like say some of the girls, what they do is like in the school, they always say, okay, in the class, they want to be in the front and say, I want to do this work. I want to go around. Like they're moving a lot. They're going for toilet breaks a lot. You need to watch out that.
Okay.
Is it really the toilet, or is it the one they want that movement break because they can't sit at one place?
Sure.
It's amazing how it manifests, and the girls are actually very clever. I sometimes feel that they just they absorb and they learn how to cope with it, and then it does later in their life. In the childhood, they cope. They mimic things a lot, and they can cope because they find their own strategies and all, because it's very structured in the schooling and everything. They can manage.
Sure.
You will see definitely a lot when they go to jobs which they don't like what to do, or in university, it really hits them that time because they can't cope anymore. So it's a very, that's what I think the ratio is about 3:1. I think boys are more diagnosed than girls. It's because of this, because it's not shown. How can you measure a concentration unless the child says to you?
It's so quite challenging for girls.
Exactly. It's because you need to make that conversations actually. If they're like, we as a parents, what's happening in,
Sure. Okay, for families navigating ADHD, what is the diagnosis and what initial steps
you need to take? If you suspect, you mean?
Suspect.
Okay. Say for example, if a child, usually I've seen is it appears when they're school age, like when they go to reception year 1, year 2, they will be seeing. You might be getting complaints from your teacher, or in the home as well. You'll be seeing a lot of like jumping around. They want that breaks, and they're fidgeting a lot. They're talking too much. Like they don't even finish the conversation. They just wanted to kind of like blurb. They want to say they wanted to, like a very impulsive. Like they don't have that control of it.
Yeah.
Because usually kids are like that.
Yeah.
We can't say that. But in school, definitely they are very timid. Because it's all structured. But you will see those things even in the school as well. So if it is in the school one, the main thing is when you see at home some of these symptoms,
Sure.
you need to ask your class teacher, how is he behaving? We are noticing these kind of symptoms at home. Is it something we need to worry? Because every school has got their SEN team, like in a special education team, they will be there. So they can actually monitor the child, how is he behaving in the class? Because they are very good at picking up things. When you say something, they will see how the child is behaving, or is he mimicking anything, or is he kind of thing. And from there, they will do a SENCO, there's a team, they will refer. Either you can go to the GP. or the SENCO team, or camps, those kind of things are there in UK where you get referral. But for any concerns, if you have any concerns, speak to GP, and then they can help you out. They can see, whether it's something, that one is going on or something else going on. Okay.
Sure.
So always watch your child. I think that's what I'd say. Reinforce the good things, like positive things when they're doing some behaviors, and negative behaviors, just see the patterns of it. You need to really give that watching, because as a parent you need to observe them and see what's happening, what's not happening, and then go to the either GP or speak to the class teacher, and they can help you out the process. I mean, in the NHS it's a long waiting, but yeah.
Yeah. Usually school, for example, the child is very active, hyperactive in the home because, so he got all the freedom. Mm-hmm. But when he goes to school, he's not kind of talking too much. If we never receive any complaint from school, mm-hmm. then it would be challenging for parents to...
It will
but
be.
Still, it's a problem.
No, it is. It is still. It's not. It doesn't put the parents off. I won't say don't, because you're having a concern. So speak to the GP about it, and they will do a little initial kind of like questionnaire to see what they are up to, and then they can refer to. And it may be not. There's nothing wrong in it, isn't it? If you have a concern, always speak to GP, and we are very good. NHS is kind of good, how we have compared to any other countries. I think we are very fortunate enough to have that.
Yeah.
So at least we have that initial kind of thing. We'll tick off okay, fine, this may not be this one. But you will see these patterns. It should be more than, you will see, not like say child is having only for a month, and then he's fine next month. No, it'll be consistently, you'll be seeing for more than 6 months. It's a patterns how you see. That's what. So it's very, you need to be like a very observant, like a detective, I think, for parents.
Sure. Thank you.
Yeah.
This is a lot of emotional challenges for parents as well, right?
Yeah.
How can we break this stigma of ADHD? Especially Indian families, Asian families.
Yes, yeah, I understand. Because I think that as a culturally, we have this attitude of, just go with it, go with the flow. You need to kind of pull the sleeves up and then go on it. But parents need to get educated, because ADHD is prevalent. In UK itself is about 5%. If you see the stats, that's how it is. So it's like a mental disorder. It's like anything. Okay, so if it's any...
It should not be underestimated.
No, it's not, because if you don't treat children, that will go in the adult life, anxiety, depression. They have low esteem. You don't want that for the children. No. So I personally feel the children are the main one, very good to kind of treat them. It could be medication, or psychotherapy, whatever works for their kind of family and situation, because we do treatments for the circumstances. We don't just treat for a condition. Basically, say for example, if a child is having an ADHD, okay, and he's struggling with what he needs to do. Say he wants to go through the GCSEs, or he's not able to do his maths, English. Obviously, we need to medicate them to get through that stage. Sure. Maybe later in his life, he may not need it, because we treat for the circumstance of what's needed for that. Sure. That's what the medications are for. Yeah. They're not for like you don't need to take it for lifelong.
Sure.
These medications. But as I said to you, you need to understand, for parents as Indian families, we need to kind of more open-minded for parents. There's nothing wrong in it.
Nothing wrong in it.
Exactly. Yeah. So it's good, isn't it? You'll have more knowledge, because it's like what we have seen, historically, a lot of studies have been done. When the parents go for a child's diagnosis, the questionnaires they do, when they're filling in, because the parents have to fill in as well.
Yeah.
They fill in and they say, oh God, this is what I felt as well as a child. Same thing. So even they're already diagnosed, because nothing has been picked up with their parents.
Sure.
So you can actually see it's a very detailed questionnaire when we give the questionnaire it's a like 2 or 3 kind of thing guidelines we do as a part of thing. And when you do that questionnaire, you will understand it's a kind of manifesting from there. But as an Indian family, you need to definitely open up and see the things. It's your own child.
Essentially, if you're not really accepting it or delaying it, you're harming a child.
You're harming a child, definitely. For children, definitely. That's the reason why it's very, very important in ADHD. You treat them just when they're in school, at the school age, like, like when they're up until when they go like study, like, after that, they can pick up what they want to. Because you're increasing their self-esteem, boosting their energy, like, they're confident.
Sure.
They're not labeled because they will be thinking, oh, I might be lazy. Because why every time parents or teachers are saying, oh, you can't do this. Why you're not doing this? Why? Even for us as an adult, we feel very overwhelming, isn't it? Don't you think so? Somebody's comparing with someone. Somebody's doing this, why you're not able to do? Your sister is doing, why you're not able to do? Or your brother is doing, why you're not able to do? Sure. That's very, very bad. It's just general. It's nothing to do with ADHD, but general. The how the child behaviors, how its development is like. That's how they learn. Cause and effect. I think that's what they say. Like, say for example, if a child is like shown a toy, when he throws it or it breaks it. And then it's a negative. He feels that, it's bad. That's how he learns the consequences. From the consequences, he learns. And the same thing, if you're giving him sharing and he feels that positivity, then he thinks, the sharing is good, breaking is bad. So it's a cause and like an effect. That's what the children learn.
Sure.
From that's just basic science of it, how they learn.
Sure.
So we need to, the positive enforcement is very, very important. So something they're very good. You say, oh God, you're very good. And something you're not. It's okay, it's fine. It's nothing to, you concentrate on the positive sides.
I've seen really successful stories who are having an ADHD. I'm talking about this adulthood. The people like, they're claiming, I'm diagnosed with ADHD, but now I'm this. And they're proudly saying, and they're very, very successful. If they pick up something, they will be, focus on one thing.
Exactly. It actually navigates how they want to. I mean, there's a very good psychiatrist in US, I love him, Dr. Edward Halloween. He describes ADHD as having a Ferrari like engine where the bicycle brakes. I love that phrase because that's what it is. Because they have the Ferrari engine, so powerful. And if you put them in that car, a bicycle brakes, how they're gonna work? They can't shut down. So all this medication, the therapy, it helps them to strengthen that brakes. That's what it does, and they become a champion.
Okay.
So it's like a superpower.
So based on your explanation, so we move on to the next one. What are primary medications used in ADHD?
Okay, there are 2 types are there. One is stimulants and other one is non-stimulant, okay? I'll just explain to you, like, stimulants are basically, it helps with the dopamine. In the brain, we have like a frontal lobes. That's the main part, which helps with all these executive function and the concentration and impulsivity to control. Those are the main ones. The prefrontal lobes, exactly, the cortex one. That's where it's the main one. So these stimulants helps them to exhibit that, the dopamine releases that one. Okay, it strengthens that. So it basically strengthens the brakes a lot with a whole rush of, like say a rocket going on, with full engine. It just gives you that push for that. That's how the stimulants work. And non-stimulants it's a slow kind of like a coaching kind of thing, very slow and pace. It takes a little time, but it helps. It's a non-epinephrine, one of the chemical in the brain. That's what helps them. So that's how they work. They are like chemicals, but they help you. You can ask me, okay, you're saying stimulants. Stimulants means the child is hyperactive and you're giving stimulants. Does it not make him hyperactive? But what it does, the stimulants what we give for a child, it strengthens the brakes. It doesn't strengthen the hyperactivity of the nature of that brain. That's what it does. So that's how the mechanism is about. So it's very, very important to understand that, because everybody, when they see stimulant, it's addictive, it's bad, we are stimulating. It's not because of bad. They don't want to medicate a child, because why do you want to medicate a child when they're 6 or 7 years old? They don't want to. But if it helps them, I will highly recommend that, because you will see wonders, like how they approach their life.
So it means like emotion, even for adults, it's kind of emotional controlling, right? Pre-control.
Exactly. Emotional regulation and then executive function.
So you're saying if they use the medication that helps them, the neural pathways.
Yes.
And then will be kind of, hardwired there, to thinking slowly.
Exactly. I mean, it helps them to sit and concentrate. I've seen, in my, in Buckinghamshire, where I work now, in a community pizza work, I've seen so many children. It helps them so much. I mean, on the hindsight, we got side effects as well, but that's the reason why specialists are there, to tailor the medication.
Right.
So it's not like you just given one and they won't leave you like that. So in here, how we do is like up until 18, the community pediatric team, they take care of every year. We do annual reviews.
Sure.
We check the blood pressure. There is a lot of things out there. We monitor them.
It's a safe side. At least we are in UK, so blessed.
Yeah, it is. And then they change. You see, we change. As a person, we change as they grow.
Right.
Maybe the dose might need to increase, or maybe they don't need it. We don't know.
Sure.
So that's the reason why it's very important we tailor that.
Sure. Okay, question now. Just now you mentioned side effects.
Side effects.
What is common side effects?
Common side effects. Okay, fine. The main thing we see is a loss of appetite. They lose their appetite.
Okay.
Yeah. And they might get some headaches. Sometimes they become hyper. I mean, like more. It gets worse, actually.
Right, sure.
Really worse. I've seen children.
Before actually
they're already hyper.
Yeah.
And then they become more hyper as well.
Right.
And then they increases the blood pressure as well, some of them. But as I said to you, these are there. But compared to what it gives them, what it helps them to go through in their like path of education or something emotional, it's a lot. And then we tailor the medication. That's why the specialists are there.
Sure.
Where we tailor, we look into their, and then see how it goes. Loss of appetite. Say, for example, if a child is having usually what happens, it's a peak. See, some medication, when I said to you, stimulants, the medication is called methylphenidate. We have like an 8-hour release, 12-hour release.
Sure.
So usually it's about lunchtime, it gets a peak. And then the kids won't have any lunch in their school. That's what we see. So we say them, okay, give them a full good breakfast. Like say, not just like a cereal or something.
Right.
Full on, like a dinner or lunch, how we give them. Full on breakfast, take the medication. Even if they don't have anything during the school, it should be okay. As soon as they come, they're hungry, give them a dinner.
Yeah.
If you want, in the night, you can give them a double dinner.
Right.
So you're having 3 meals a day.
It's okay.
It doesn't matter how.
Sure.
So we can all approach this. The clinicians can approach that one, and we tailor it. So there are every paracetamol has got a side effect, so I can't say that. So you can't expect
everything is side effects, but is it minimalistically to address some bigger issues in the future?
Exactly. So, but I said to a lot of kids, even when I say to these side effects, we tailor. We find that right balance. We need to find a right balance. You see, we don't want to lose their personality. So every child has got their own personality. We don't want to lose that. Sometimes they become very timid. We don't want that either. So we change it. So it's working very well. The parents say they're working very well, but he's becoming he's not anymore that boy or girl or very active. So we'll say, no, that's not good. Because we want that personality to come in.
Yeah.
All right?
Yeah,
so we find the balance in the treatments.
Sure. Any supplements? Medication is one thing. Any supplements can help?
Yes. As I've seen most of the children with ADHD or autism, they are very picky eaters. They're very, very picky. They don't like, say, I don't want this, I don't want that, I want to be fried this way. We see a lot. They want a bland food, like say only chips they eat, something like that. It's like a very beige kind of food color. They don't like green. Like in their plate. We see a lot of these things. So definitely they might be deficient of it, like these kind of nutrients. So I always say, watch out what you're giving to your child. Are we having carbs, protein, fat? Everything is included in their diet. Say, for example, if they are not eating any fish, so there is no omega-3. And anyway, ADHD kids have low ADHD. Like low omega-3, sorry. No. They have low omega-3s. So you need to supplement them with omega-3 liquid if they don't eat fish. So vitamin D, iron, we need to check all these things, how they are, because it impacts them. And as most of scientists nowadays, there's so much of research going on with the gut and brain, the axis, the gut and brain axis. So what you eat,
and brain, okay.
What it manifests upon. So if you feed them a varied food, the gut will pick up the bacteria, very good bacteria. But if you feed only one food all the time, it doesn't have varied bacteria to work on your gut. So you can't just give just one type of food, because usually we have this tendency, isn't it, for parents. So when you have 2-3 kids, it's so overwhelming. You can't make everyone each one. So we say, okay, fine, he likes, say, bread or something. So we give him bread because he's eating something. But try to give that where you can have varied diet. I think the parents have to learn different strategies. Or learn strategies, because we're not used to kind of giving them, isn't it?
Yeah, exactly that. Leaning towards my next question, are there any lifestyle changes, interventions that Indian families, especially Asian families in UK, can implement?
I mean, there are 2 types, I think. It's not just Indian families, but anyone, the parenting style. Because there is a lot of research has been done on the parenting styles. We have like 4 types of parenting style, where whether we'll be very strict, with no passion, like no compassion, no kind of with the children, or we are very lenient, and then with so much warmth but less lenient. We don't set rules, okay, and one just ignores it, or one like it's kind of thing. But the best parenting approach I feel is like you need to set boundaries, but with compassion, with support, with warmth. That's very, very important. It's called authoritarian. I think that's what it's called actually. The parenting styles, there are some styles in it. But that's not the best one because you need to set them. You need to set them. And with the ADHD especially, they need a routine. Without a routine, they can't work. And right from the beginning, if you maintain that routine, it will really, really help them. You're doing the best thing for the children is that routine. Say, for example, major issue I see is like getting ready for school. Say, for example, all the time, it's a problem with any child. They don't want to go to school or something. So if you're telling them the time you need to, as a parents, we need to be like prepared, like as if like combat warriors. I think that's what I feel actually with no training. So you need to anticipate what's coming in and then we jump in. But that's how you need to be basically when you're dealing with these children. So when the minute you want to say what time you wake them up, make sure that the child once he goes to bathroom he comes back with the uniform. Put everything in there. Rather than you brush your teeth, come back, you watch some TV or have breakfast. Why do you want to give that distraction? Because they get distracted. So why don't we do some strategy where you take everything in there. So you brush, take shower, you school uniform, come back, and then have your breakfast. Then he has the time. So you're not battling with your child every day. So it varies. You see, that's what I'm saying. It varies. How it depends upon how you want it to, and also with the parents, you need to be very. How can I say? Not reactive mode. You should not be reactive. Like we get reactive. Like when they're like you're shouting and all that. When you're not doing it doesn't help them because they're not even listening to you. It just blanks. They're not getting into that. So there's no point.
So especially parents need to be educated.
And
first, if you don't know all this kind of what you're talking about, I mean, like what you shared, it's quite challenging, right?
It is.
Because we brought up in certain by parents, like okay, this is the thing, like we
because we've already been told, okay, what parents says is right, and then we have to listen to your parents. That's it. But it doesn't work like that now. It doesn't, unfortunately.
It's educating. Parents is very important. That's at least give them the steps.
I think what I feel is why you want to keep it to yourself. Like so I've seen that, and also in Asian parents, I've seen only one parent does everything. And other parent just is not there present. Parenting is not that. You both have to be involved. I've seen many times with this one. Even for appointments, only one parent comes for the appointments. That doesn't, or mother doesn't, anyone, I'm just saying to you. So that's how it is. It's overwhelming. It's overwhelming for a woman or anyone who is taking one parent to take that stand on a child who very demanding. I mean, basically you're raising like 3 kids, 1 kid to 3. Like, when you have the challenges and you have to do your own job, you have to do everything. So as a parenting, you need to be together. And also there's one thing which I feel personally is like, say for example, if you're as a parents, you've discussed, okay, this is what the rule is. We need to make sure in our house, this is the rules. Stick to it. And say, for example, if a husband or wife doesn't like on one thing, but when other parent is disciplining one, don't come in between at that time. When the mom is disciplining the child or dad is disciplining the child, the other parent should not say anything at that time. You both can discuss later on what are the strategies we can do, but not in front of a child. It's really bad because then what happens? The child is very, very clever. The children are very clever.
Exactly, that's what I'm going to make.
They learn. I was like, okay, fine, then I know where to. They exactly know. I mean, every family knows. For these things, I can go to daddy. For this, mom, how did they know? Did anybody taught them? No. They've seen it.
No, this is happening everywhere. I can easily relate that one.
So it's very important. You need to step back. I know as a parent we wanted to help them a lot, but you need to understand that. Take some step back and have that thing. Give that time. When somebody's, I know it may be wrong. I'm not saying it's right all the time. So whatever, say for example, if dad is disciplining a child, it's wrong. Mother feels that's not the way it should be done. Don't jump in at that time. Let him finish off whatever he's doing. And then after goes, then you both discuss in private and then implement that one. That's what it should be.
Okay. So, thank you. It's going well. What advice you have for parents take care of their mental health,
Mental health.
well-being, because
that's
this is a quite challenging thing, right?
It's a very important, very important. We don't understand. We always, I mean, you don't want to drain to a situation where you can't give anything to your family or to your child, isn't it? So you need to look after yourself. That's very important.
Sure.
I think it's about the emotions as well, how to control our own emotions. That's very important, because we don't tend to do that. We bottle up a lot of things because we think as a parent or as a mother or a father, we need to help them and suffer that. You don't need to, okay? You need to have that emotional control for our parents as well, because we are also learning. It's not, nobody teaches us how to be parent, isn't it? It's like a learning curve.
Sure.
And there's nothing wrong in it. Say, for example, if you've done something wrong, there's nothing wrong in saying to a child, okay, fine, all right, I'm sorry, whatever, okay, sweetie, I thought this is on, but it's wrong. So you can say that, it's nothing. And children appreciate that, really appreciate that. Like, I think one example I can see that where, say, for example, I don't know, when they're, like usually happens, I think every household happens this one. They're all ready and everything, they're going to school. They don't put the shoes on. The last one, just put the shoes on, go to the, step out of the house. It never happens. It's a big struggle. Why they won't do it? But if you have like plan, you need to tell them, you can say them, okay, come on, Raj, you're running, you're picking up. It doesn't work. They're not even giving a damn about it, what you're doing, what you're shouting. So if you tell them, all right, I know it's hard for you to get up and then do things, but we have to do it because you have to go to school. And in that composure, you need to make sure that it's done. I mean, I'm not saying every time you can ask me whether you do it in the same way. Not every time, but I try to do, definitely, because if you have that routine, you have that thing.
So discipline, habits and routines is a very crucial.
It's instrumental, I'd say.
For whatever you do, diagnose, supplements, medication, but every day.
They have to have the daily routine. Say, for example, the kids become an ADHD, they can't sleep. We have a sleep medication we give to the child. If you don't have a sleep routine, the medication doesn't work. So we won't even initiate the medication until we are assured the child is having a sleep routine, like an hour before, no screen time, lights are dim, and it's very important that I mean, there's so much of research has been done where it's important to say 7:30 sleep, he has to be on 7:30 on dot. It doesn't matter whether he's sleeping or not, but you need to have that routine. The routine doesn't mean only school time, even on the holidays. So you can have a different routine. But make sure that school time is this routine, holiday is this routine. You need to have a routine. And it makes much easier, don't you think so? Like if you have a routine, you know exactly, like you know how you're having a menu, okay, what to cook for. If you make a plan, it's so easy. Okay, Monday, Tuesday, Wednesday, what it is. So it makes parents' life much easier.
It helps in general as well. Like, you know, it's not only ADHD. It helps everyone. You know, it's great. So I take that as a very crucial, important to not to overwhelm. The discipline, habits and routines is very important.
Because it's very interesting how it is like, you know, because we are all human beings, we're all learning, you know. We have our own challenges in our lives. But if you can actually step back and make a plan, actually you need to make a plan. I mean, for kids who are having ADHD or whatever, or some challenging behavior, like, you know, sometimes I've seen kids 6, 8, 9 years old children are depressed. Why is it happening? You know, you need to have that. You need to give that discipline and also that warmth and support. It's very important.
Thank you. I know this question you covered, but just a quick one. Are there any gender difference in how ADHD present in children? You covered.
So boys and girls, as I said to you, because of the boys are hyperactive, generally, okay? That's why it's picked up very easily, because everybody can see it, but girls is not seen very often. And usually I've seen kids, ADHD one is picked up in secondary school somewhere around.
Oh, that's quite late.
I mean, it's not later than sooner. That's what I'm saying to you. So I'll tell you how our brain works, basically. A brain development. Okay, the frontal lobes, when I said that's very crucial. In teenage, it starts from the frontal lobe, teenage years to 25 years. That's how the frontal lobe, the development of it. The kids with ADHD have very slow development of the frontal lobes. So that's what it is about. So all this medication or whatever psychotherapy or whatever CBT, anything, it helps them to get to that one. And after 25 years, it's there because we learn how to cope and everything. Okay, that's why it's very, very important. That's how the development is there in the frontal lobes, if you see the brain development.
Is there any genetic inheritance?
I mean, inheritance, if the parents have ADHD, is very likely to have an ADHD.
Okay.
But not, like say if a parent is depressed or something, no, not really. Because I'll tell you what, there are genetic conditions where like cystic fibrosis is like a lungs condition, where it's genetic, definitely it's genetic. We haven't found out the reason why autism causes, why ADHD causes. Nobody has found out. They just said it's the root causes. We say, what are the root causes of ADHD? Say there's a genetic influence. It's not like genetically, but it's genetically influenced. Obviously, we inherit from parents.
Sure.
So anything, like, height, weight, whatever, like eyes and everything, hair, we inherit from the parents, isn't it?
Sure.
So we inherit some of them.
Yeah, okay.
It's like it's influenced from the genetics, obviously, and some metabolic disturbances as well, nutritional deficiency it could be, and it also could be like environmental toxins. We never know.
Sure.
That's all impacts our kind of brain, how it works. Like say a child who's having allergies and we don't know you're having an allergy. It affects their kind of like, not only just, I said to you, gut it affects, but also the brain. So it's it's a holistic approach. That's why we need to take care all aspects of it. And when I said to you, when parents, like when you asked me about the impact as well, that's what I wanted to, because I've seen parents who are like, they go to everything, whatever they see. They've heard about this treatment, they go everything, they want to try.
Sure.
Some parents, they won't do nothing. I want them to get the middle part of it, where you need some kind of a education, what is right and what is not. So we need to have that kind of a bridge, isn't it?
Sure.
So I think I can be like that's what I'm trained at. Like I can have that bridge and see what's needed, because we don't need to do all the things. You try homeopathy, you try this. Somebody says there's a treatment. There's no treatment. It's not treatment. Okay.
It's more. Yeah, I can see that pattern. Yeah.
Yeah. So
Sure. It's more rather than like you discipline yourself, you're controlling your emotions, you're educating yourself.
Yeah.
So
And then
you're depending on medication. You want to try everything, but not actually what you mentioned, that pillars.
I think with the ADHD, that's why it's been proven. Because once you stop the stimulants, when I'm saying, it's very good. But if you stop them, it stops. You will go back. That's what does medication.
Habit formation, right? So
Yeah,
sure.
Yeah, but that's the reason why ADHD coupled with good diet. And the skills. Psycho skills, psychoeducational skills. Either it could be CBT or anything, that kind of thing, okay? And teach them how to, and I like one of the things where, like delayed gratification.
Delayed gratification,
So you know about that. That's very good. We need to teach them, children. I mean, for the viewers who want
there is a marshmallow test, right? You know that, right?
Exactly. So that's very instrumental about that one. It's very, very important. We always do. I mean, like not always do, but we do. Like somebody, say for example, if the child is not eating this, we'll say, okay, fine. If you eat this, you'll get your sweet or you'll get your cake. That's what delayed gratification is about.
Of course.
So, but that has to be planned and done in their kind of thing. Why can't we use that same thing?
Great advice.
So it's very, very important.
It's an equally important role for parents as well as children.
Children need to have that assurance. Oh, parents are there for me to kind of help me.
Sure.
Like teenagers is the worst years, I can say that. Worst years. Because they don't care what parents say. But you need to have patience. But that's the age that will pass. Once they're 18, 19, they'll be very good. But if you lose out that thing, that 6-7 years is very bad, because especially girls, very emotional. Very emotional. And then they say, okay, whatever we do is wrong. I mean, it's very common. I mean, we also experience the same thing.
Sure.
So why can't we just learn from that?
Great. Can we talk openly ADHD with our children?
Oh, yeah, why not?
Do they mind?
No, they don't mind. See, I'll tell you what. When you're
psychological, because
exactly. You need to let them, because they don't understand. Parents are shouting, or parents are saying, but I can't do it. But they can't express themselves. Bless them. Like if you're asking an 8-9-year-old express it, how can they express it? Tell me. They say, I don't like it. That's what they say. But for us as a parent, what do you mean you don't like it? Why you don't like it? That's the question. It's a very common thing, isn't it? But they can't express it why they don't like it. Because we don't see that. But I think say for example, I'll tell you with the parents as well, when you're discussing, you need to learn first how to say to your child what to say and when to say. This is very, very important as well. All right. So first learn how to do it. And then explain it. I think they will like it, because at least they will understand it's not me there is something, and parents are there to help me. That
Sure.
assurance is the greatest one. It's very great.
It's important.
Because if you see, there are a lot of like all the good, like Elon Musk and all, they all have ADHD. But I mean, they've gone through with the trauma. Trauma led to something. They found something in their passion and they did it.
Yeah.
But you can't expect everybody to become like that, isn't it?
Sure.
You need to be.
Got it.
You need to give that kind of environment as well, and then you never know what they'll turn into. It's like a superpower, ADHD, I feel, because they're so good.
So good, yeah. I'm seeing successful stories more.
Some of the things are...
But as long as you're supporting your child...
Yes.
In the, you know...
In the right way,
in the beginning...
Yeah. I mean, I don't blame
you
her.
cannot change anything, right? So...
No.
If it is if it is happened, manifested, you cannot do much about it. No. All you can take action, help the child, and give that just find the superpower, work on it, and you will be star.
Exactly.
Isn't it?
Yeah, because I've seen people like because as you know, I do genetic testing as well, and
yes.
So I have seen a lot of privately. I do privately that one. So, but the lot of ADHD patients also come to the side because they've got other things as well, psychiatric problems plus ADHD on that. They're all like somebody has been very good CEO of some company. They're studied in Oxford, never been diagnosed. Diagnosed later after COVID, like COVID happened.
Sure.
But when they go through that, I say, oh God, man, there's a lot of things happen because it's emotional. Because the ADHD symptoms have come up because they're depressed in their job or something like that, and that came up. It's not like it's there. It's overwhelmed, And then at least some of them are very happy. Okay, fine. At least I know. They don't want medication. It's fine because they can manage it.
Sure.
But at least they know. Don't you think like we need to know like an assurance of it?
Sure.
I think that makes more half done job. I think once you know what's the reason why you're behaving like that.
Yeah, thank you. Now it comes to NHS, especially. Generally we have a waiting list for everything, right? Yeah. So what is typical waiting?
It's about 2 years.
Duration
minimum 2 years.
ADHD. Okay.
Minimum 2 years, I can say that.
Sure.
And also now, currently, what's happening, I'll tell you why. There's a shortage in medication. We are really having a struggling everywhere in the UK, I think, to get the medication.
Shortage of medication?
Yes, the ADHD medication. So it's so difficult. One comes, other goes off. So it's because these medications cannot be changed by GP, and it has to be done from a specialist. And then we have to literally find what medication is now available and then give them. We can't just switch it over like that, isn't it? So it takes a lot of time, and then that's the reason why it's a lot of waiting things.
Quite challenging for doctors as well to treat the child properly.
Yeah, to start some other medication, we've been given clear instructions. I mean, certain medications we can't start them because of shortages.
Yeah, because maybe kind of interdependency.
Exactly, and you know why this happened? Because after COVID hit, most of the adults are coming privately. They're doing the diagnosis of adults because it's the same medication.
Yeah.
The doses are changed, but the same medication we give.
Okay.
So the adults one came up. So if you see the pharmaceutical companies, how they do manufacturing, I think they plan ahead, 3 or 4 years ahead. And this is not. It's overwhelming for them. That's why it's even for our own kids in our hospital too.
Sure.
So we keep the stock for them. Say for example, usually what happens when all this is done, we give a shared care to GP. So they don't need to come to the hospital every time. Once it's been stabilized, we give them shared care protocol. That's what we call. They give to the GP, and then every month they will get these medications from the GP. And every year they come to the hospital just for a review. Okay, that's what the process is.
Sure.
So from the GP, they're prescribing, but they're not getting medication. So what they do is we are trying to get our children who are from the hospitals, because we still keep them under 18. We still see them up until 18. So we give them, if you have in stock, we try prioritize that. But yeah, it's a I don't know when it will be gone.
Sure.
Yeah,
okay, you just mentioned about the private, but my question is, how much does private ADHD diagnosis and typical cost in UK?
It's very expensive. It's about, varies from 1,500 to 3,000 pounds. This for diagnosing. And if you want a medication, each medication costs around 40 to 80, I think. Between somewhere around. And also extra to write a prescription. So it's, but once you get diagnosed and starting on, usually what happens, most of the GPs are okay. Some GPs are okay to kind of take over from the private as well. So what the shared care protocol, what I'm talking about, same thing. So what they do is they do privately, and then they write to the GP to take over, and then every year they continue the treatment, and after 1 year they'll go again privately, or maybe they'll be transferred, because these are all the children, they're on the waiting list of the NHS. You can't wait. Say if a child is in year 10, and they want the GCSEs done. You can't
Yeah.
wait 2 years for the child, because
Sure.
if you just imagine low GCSEs,
Yeah.
then that means their life is all turned upside down.
upside down.
They don't want to do what they want to become.
My final question would be, what resources and support services available for family affected by ADHD UK?
Yeah, I mean, like, there is a very good book if there somebody wants to read about
Sure.
Understanding ADHD by Christopher Green, I think. That's a very good. And there's a magazine, it's called Attitude, ADDITUDD, I think Attitude. You can write down in
Sure.
the...
I can put everything in a description.
In the description.
Yeah,
That's
please.
a very
Yeah.
good magazine.
Yeah.
You can get, and ADHD UK, like, the foundation one, they have that resources. Go through that. It's a lot of podcasts out there, a lot of information in that Attitude I love that magazine. It's really good.
Sure.
And it tells you, it also gives you like kind of like in the home, like to see parents, you're asking about how can we know. So
Yeah.
it gives you the DSM-5,
Sure.
the minimum one.
Right.
Just you can see those things. What are the criteria? How many are there?
Okay.
So I think it's about 6 or above. They should qualify those criteria. It's there. It's all written there in that. So yeah, that's how it is. And then that's the initial one. You see,
Sure.
that's the initial one. That's where
Sure.
you go. And yeah, that's what information resources.
Well, thank you. Thanks for joining.
Thank you. It's
And
a
I'm
pleasure.
sure I will look forward to more.
Updates on my thing, what I'm going to offer actually.
Yeah,
Things,
sure,
yeah.
sure. Thank you.
Definitely.
Thank you, Ujwala.
Thank you so
Thanks.
much, Sham.